It's a very important, simple, meaningful quote. You have to understand this. Pain is temporary. Pain of clearing exams, pain of reading so many subjects all together, pain of not able to cover the syllabus, but quitting lasts forever. Like, you should not quit. But my sincere request to all of you is that only, I know it is difficult to cover the exams. I know it is painful to remember so many syndromes, so many, triads, and so many image based questions. But if you quit, quitting is not the solution. Quitting is not the solution. This pain which you are feeling right now, it's just temporary. If you clear the exam with good marks, then your whole life is set. So this pain, I agree, it's too much to cover, too much to remember, too much to retain, but this pain is just temporary. But if you quit, that quitting will last forever. So my sincere request, try to participate, try to understand, and try not to sleep during the class. So question number one, this is the first spotter of the class. Could anyone can recall, can anyone tell me what do you think is the spotter? What do you think? If I show you this sign, can anyone help me out? What is this? What is this abnormal fusion of digits known as? Can anyone help me out? Can you see this abnormal fusion of digits? Yes or no? Very good. So we have Meghna who is already answering. This is nothing but a case of syndactyly. Very good. We have wonderful students who are answering so well. So this nothing but it's a case of syndactyly. Okay, syndactyly. Okay, so please remember this. Can we appreciate this one? So abnormal fusion of the digits is nothing but syndactyly. Very good, perfect answer. So can anyone tell me what is okay? What is brachydactyly? Can anyone help me out? What is brachydactyly? Any wild guesses? See, syndactyly is abnormal fusion of the digits. So can anyone tell me what is brachydactyly? Any random guesses? What is brachydactyly? So I'll show you a picture. Yeah, very good. So this is a case of brachydactyly. This picture shows brachy, BRACHY, brachydactyly. That's it. Are you understanding? See, brachydactyly is short fingers, short fingers. Short fingers, choti ungliyan. Short fingers is nothing but very important. Brachydactyly. Please remember this. Okay, I'll repeat again. So what are we starting? We are starting the image based questions of the pediatrics, and now we just now covered syndactyly. Syndactyly, I told you, abnormal fusion of the digits. Fusion of the digits is syndactyly. And what is brachydactyly? Brachydactyly is short fingers or short digits. Okay, are you understanding? So syndactyly over, brachydactyly over. Okay, now one more picture. Let me show you. What is this? Can anyone tell me? I have this one finger, two finger, three, four, five, and six. What do you call it? Condition. Very good. This is nothing but polydactyly. This is nothing but polydactyly. Yes, we have Mr. Sudesh, Neetu, we have Preeti. Right, it's a case of polydactyly. Okay, polydactyly. So I'll repeat again. Next important slide. I'll show you one picture. What I'll give you 10 seconds. Can anyone tell me what are the findings can we appreciate in this child? Any random guesses? Let's see if anyone can answer this question. What are the findings? Very good. Yes. What are the findings you can see in this child? Yeah, legs. Yes or no? Bow legs. So what do you think? It is genu varum or genu valgum? What is this? It is genu varum or genu valgum? What do you think? So imagine a rum bottle inside. It is a rum bottle. So it's a genu varum. Genu varum. Okay, very good. So this is the case of rickets where the patient is coming to you with bowing of legs. Okay, bowing of legs, and what is this? Widening of wrist. Bowing of legs and widening of wrist. Okay, bowing of legs and widening of wrist. It's a case of rickets, and I can see genu varum in this case. Yes or no? So what is the treatment? Anyone? What do you give? What is the treatment for this nutritional rickets? So what do you want to give? Any random guesses? What treatment are you expecting to give this in this child? So what do you think? Yes, very good. We have Ria Mittal who is answering. We have Sheetal also. So vitamin D therapy. Vitamin D therapy, usually vitamin D supplementation is what in general we follow for this one. Okay, that you should know. So it's a case of bowing of what do you called bowing of legs and widening of wrist. And in general, we give vitamin D supplementation. Okay. Next question. So Gurpreet also is answering very nicely, very good. So now what is this X-ray? Can anyone help me in the interpretation of this X-ray? What is this X-ray showing? If I give you a hint, it's a X-ray of a neonate. It's a X-ray of a preterm baby. What is preterm? Less than 37 weaker is a preterm. Any random guesses? What is this X-ray demonstrating? Any random guesses? Anyone? The hint is it is a neonate and it is a preterm baby. And what is this? What is this lines? These lines. What are the? Can you see that? Yes or no? What are these lines showing to you? This one. Very good. So this is nothing but known as air bronchogram, which is seen in a case of hyaline membrane disease. Hyaline membrane disease. Very good. So Alka and Ria is very right. This is the case of HMD. It's a HMD X-ray. HMD means hyaline membrane disease. What basically happened? There is a deficiency of surfactant. Have you heard the name surfactant? Surfactant, which is helps in maintaining the patency of the alveoli. I'll repeat again. This X-ray is a case of, it's a preterm hyaline membrane disease. It is a disease seen in the pretermers. Why? Because of the deficiency of the surfactant. Okay, deficiency of the surfactant. And this lining which you see, this one is nothing but very important, air bronchogram. Air bronchogram, it is seen in hyaline membrane disease. Remember that. Okay, remember that. We have Kanchan and Rani. Very good. So you're answering very right. Very right. Okay. Next question. So again, this class I'll be asking you, I'll be showing you one picture, one answer. One picture, one answer. We will not go into detail. In the detail, it is already there in our mobile app. Now this X-ray, can anyone tell me what is this X-ray showing? Any random guesses? Not this one. So what is this X-ray? What are the lungs showing to you? What are these things? Can anyone tell me what are these opacities? So you can say, so it is okay. So we have Anshu who is saying tetralogy of Fallot. No, it is not a tetralogy of Fallot. So this X-ray, this patchy, can you see patchy infiltrates? Patchy infiltrates. Point number one. Patchy infiltrates. Is my audio coming or not? Okay, 1 second. I'll just change it 1 second. Yes, so we can see very important is nothing but a case of meconium aspiration syndrome. And in the meconium aspiration syndrome, we can see patchy infiltrates. It's a case of meconium aspiration syndrome. That's what you should know. Okay, next one. So what do you think now this picture? Any random guesses? What is this? Now audible? Okay, very good. So Muskan, what do you think is the X-ray? What is now, like, what picture now can we appreciate? Can you see this swelling of gums? What X-ray do you think? What is this picture now? It's a case of scurvy. It's a case of scurvy. Yes or no? The picture is seen. Can you see the picture now? 1 second. Yes. Okay, the picture, it will come. So it's nothing but bleeding of gums. Can you see this picture now? Yes or no? So this picture, yeah, this picture is a case of very important bleeding of gums. It is seen in a case of scurvy. Okay, swelling and bleeding of gums. It is seen, yes, scurvy, very important. It's a picture of scurvy. Remember that, vitamin C deficiency. Vitamin C deficiency. Okay, simple picture. So we have covered around 20 image-based questions we have covered. The image number 21. This one, can anyone tell me? You heard the name of KF ring? Any random guesses? Which disease can we think of in the case of this KF ring? We have this Desmond membrane of the cornea, and we have this KF ring. So what do you think? In which disease have you heard the name of Kaiser-Fleischer ring? Yes, very good. Yes. So this is a case of Wilson disease. It is a case of Wilson disease, very important. So what is the gene mutation? Can anyone tell me what is the gene mutation in Wilson disease? What is the gene mutation? So what is the gene mutation it is there in Wilson disease? Please remember ATP7B. ATP7B gene mutation. It is there in Wilson disease. ATP7B. It's a very important question. Please remember ATP7B gene mutation. This is a recent exam question. Very good. We have Mohammed Saif who is answering. Anuradha also is very right. So these 4-5 genes are very important. ATP7B, ATP7A, FGFR3, FGFR2, and FGFR1. So please remember ATP7B gene mutation. It is seen in Wilson disease. Okay, Wilson disease. This is the gene mutation. So I'll give you a chocolate if anyone can tell me what is the gene mutation in ATP7A. Anyone? Any random guesses? ATP7A gene mutation. It is seen in which disease? Very good. So we have Mohammed Shukri. He's answering Menkes disease. Menkes disease. Please remember this. It is important. These all are one-liners. These all are exam-based questions. They have multiple times they have asked in exams. So ATP7B gene mutation A, it is seen in Menkes disease. FGFR3, remember FGFR3 gene mutation it is seen in achondroplasia. Achondroplasia. Okay, remember FGFR3 gene mutation, it is seen in achondroplasia. FGFR2 gene mutation, it is seen in Cruzen syndrome. And FGFR1, it is Pfeiffer syndrome. Pfeiffer syndrome. These all are exam questions. Please remember that. ATP7B is Wilson disease. ATP7A is Menkes disease. FGFR3 gene mutation, it is seen in achondroplasia. And FGFR2, it is seen in what you called Cruzen disease syndrome. And FGFR1, it is seen in Pfeiffer syndrome. Pfeiffer syndrome. These all are important questions. Please, this is a very important slide. Multiple times they have asked in exams and you should know. Okay. Next, this is a simple X-ray, simple image-based question. So what do you think is the answer? Rahul Chaudhary, we have Sunil, we have Gitanjali, everyone answering very good. This we all know that even my grandmother also can tell this answer. It is a case of boot-shaped heart seen in tetralogy of Fallet. Okay, very good, Pooja. Everyone is answering. So tetralogy of Fallet. Very good, very good. Rekha, very nice. Okay, if I give you now next hint, if I give you this picture and I'm telling you the 3 hints, the hint for this disease are hearing loss, distinctive hair coloring. You can see this patient is having a white bunch of hair in the front, and heterochroma iridis. Heterochromic iridis means one eye is of different color and one eye is of different color. So where do you see this condition? Where do you see this condition? One eye is different color, one eye is different color. So can anyone tell me? I'll give you a toffee if anyone can tell me which syndrome are we talking in this case. Albinism, no. Anything else? Sangeeta, what, any syndrome? So please remember, it is a case of this triad of hearing loss, distinctive hair coloring, and heterochroma iridis comes under Wardenburg syndrome. Please remember Wardenburg syndrome. Remember hostel ka warden? Remember in your hostel you have hostel warden. Very good. Gurpreet Kaur is also answering. Very good. So remember hostel warden. Hostel ka jo warden hota hai, imagine your hostel's warden in the night roaming here and there. So he look like this. Okay, like a warden. So Wardenburg syndrome. Okay, so hearing loss, heterochroma iridis, and distinctive hair coloring. Okay, hearing loss, heterochroma iridis, and distinctive hair coloring. Wardenburg syndrome. Very important exam based question. Wardenburg syndrome. Next, it's a very important picture. Very important picture. What can you see in this slide? Can anyone tell me? What can we appreciate in this slide? Is this picture normal? We have Sunil. Yeah, so very good. Someone said, Rahul said webbed neck. Very good. It's a case of webbed neck. Very right. So can you see this one? So this one. So this is webbed neck, right? Webbed neck. Very good. So webbed neck, imagine if a webbed neck is a female, what will you think? And if a webbed neck is seen in males, what will you think? So Supriya is answering very right. Web neck in a female, you should think of Turner syndrome. Turner syndrome. Okay. And web neck in a male, you should think of Noonan syndrome. Noonan syndrome. Please remember this question. Okay. Web neck, if it is a female, you will think of Turner syndrome. And if it is a male baby with a web neck, you will think of Noonan syndrome. Very good. Kanchan, Pooja, Diksha, and Rajaraj. Very right answers. So can anyone tell me which is the most common congenital heart disease? Which is the most common congenital heart disease in Turner syndrome? Anyone? The most common congenital heart in Turner is anyone? Any random guesses? People are saying VSD. No. So please remember. Please remember. So the most common congenital heart disease in Turner syndrome is bicuspid aortic valve. Bicuspid aortic valve. And most common cause of death in Turner syndrome is coarctation of aorta. Please remember, these are very important questions. I'll repeat again. The most common congenital heart disease in Turner syndrome is bicuspid aortic valve, and most common cause of death in Turner syndrome is coarctation of aorta. Coarctation of aorta. These are very random, rapid questions. Multiple times in exams they have come. And which is the most common congenital heart in Noonan syndrome? Anyone? Noonan syndrome, the most common congenital heart disease. Anyone? Any random guesses? So the most common congenital heart in Noonan syndrome is pulmonary stenosis. Pulmonary stenosis. Very important questions. Please don't remember. Don't forget it. I mean, I'm saying don't remember. Okay, so most common congenital heart in Noonan syndrome is pulmonary stenosis, and most common congenital heart in Turner is bicuspid aortic valve, and most common cause of death in Turner is coarctation of aorta. Next question. So I'll give you a chocolate. Anyone can help me out with this slide. Which is this image? What is it showing? Any random guesses? What do you think? Is this baby normal? What are the findings can we appreciate in this child? I'll give you 5 seconds to tell me. So we have Pooja. Very good. Very good. So we have Meghna, we have okay, we have Jitendra. Very good. So what we can see, this is a case of trisomy 18. This is a case of Edward syndrome. Edward syndrome. Very good. How did you know? This one. This is a very important picture. This one. What is this? This thing is known as rocker bottom feet. Rocker bottom feet. Very good, Ria. Ria is very right. So rocker bottom feet, it is seen in very important Edward syndrome, trisomy 18. The mnemonic is Rocky M, ROCKYM. If you know this mnemonic, then the syndrome is over. R for rocker bottom feet. Okay, R for rocker bottom feet. O for overlapping digits. overlapping digits. R for rocker bottom feet. This O is for, can you see this? Overlapping digits. C for cardiac defect. K for kidney defect. Y. Y for microcephaly. Y for microcephaly. That Y and Y. Microcephaly. And M for mental retardation. M for mental retardation, which is now known as intellectual disability. Are you understanding? Yes or no? So it's a case of Edwards syndrome, nothing but rocker bottom feet. It is a trisomy 18. The mnemonic is Rocky M, R for rocker bottom feet, O for overlapping digits, C for cardiac defects, K for kidney defects, and Y for microcephaly, and also what we call M for mental retardation, which is now known as intellectual disability. Please remember, very important question. Okay, next. Where do you see figure of three appearance? Important X-rays questions. So 20 more images left. This class will be exactly for 60 minutes. So figure of three appearance. Can anyone tell me in the X-ray, where do you see figure of three? This X-ray showing to you some figure of three. Figure of three appearance. So please remember figure of three appearance. It is seen in coarctation of aorta. Coarctation of aorta. Okay, figure of three appearance. It is seen in coarctation of aorta. Straight away, one-liner question for exam going. Okay, anyone having any doubt? We have this our free WhatsApp and Telegram group on 9999897081. This is my WhatsApp number. For the new students who are not a part of my WhatsApp group and Telegram group, you can just message your details on this number, and I will put you in our respective state-wise group in Telegram and WhatsApp. This X-ray is a case of figure of three appearance. It is seen in coarctation of aorta. Coarctation of aorta. Next question. Where do you see goose neck sign? Can anyone tell me? Goose neck sign. Can you see this goose neck? This goose neck. So where do you see this goose neck sign? This is a very rare question. If anyone can try to answer, where do you see goose neck sign? So straightway, the best, the winner for this is Shweta Baneshi. Shweta has answered very right. Goose neck sign. It is nothing but what you called endocardial cushion defect. Goose neck sign is endocardial cushion defect. Goose neck sign. It is seen in endocardial cushion defect. Someone is asking the number again. My mobile number is 9999897081. This is the number for the free pediatrics WhatsApp group and our Telegram group. You just have to send your name. That's it. Okay, so goose neck sign. Please remember. So just now we covered what you call boot shape heart, tetralogy of Fallot, figure of three appearance, coarctation of aorta, goose neck sign, endocardial cushion defect. Very important. Okay, okay. Where do you see this one? This is what this one. Okay, Shivani wants to see this last slide. Shivani, which slide do you want to see? Shivani, just now we covered this one. Goose neck sign. It is seen in endocardial cushion defect. Then we covered figure of three appearance, which is seen in coarctation of aorta. And then we covered this rocker bottom feet. After web neck, this slide Shivani was there. This is what you asking. So this is nothing but we all know that trisomy 18. Okay. Okay, now we'll come into this picture again. This one. Yeah. So this everyone has already answered. We have Kamla Chaudhary who has answered this. Yeah, Vikram, very good. So this is nothing but egg on string appearance. Egg on string appearance, a simple X-ray. It is seen in TGA. TGA. What is TGA? Transposition of great arteries. Okay, position of great arteries. Saurabh Mishra is answering that he was late. Will this session be recorded? Yes, Saurabh Mishra, this session will be recorded and some part of it will be there on my YouTube channel also. Transposition of great arteries. Okay, TGA. Transposition of great arteries. This is the X-ray showing egg on string appearance. It is seen in TGA, transposition of great arteries. Remember that. Okay, very important question. These are very fast random questions which you must know before going to a final exam. Okay, Where do you see signet ring sign? Any random guesses? Signet ring sign. Where do you see signet ring sign? Any wild guesses? You can see the ring, right? This is the ring, and this is this is this one. Can you see that? Yeah, we have Shehnaz Banu who is answering, and Shivangni also. Very good. So bronchiectasis, bronchiectasis, bronchiectasis. You see signet ring sign. See, image-based memory is everything in life. Please remember, try to retain as many images as possible. The slides will not be shown again, so try your best to answer. Okay, signet ring sign. It is seen in bronchiectasis. Signet ring sign, a ring in your finger sign, that is seen in bronchiectasis. Okay, remember that. Okay, and again a motivating quote in between. If anyone feeling sleepy, keep going. You did not come this far to go this far. I'll repeat again. Keep on going. You did not come this far to go this far. So you have to work hard. Don't lose focus. Don't lose your vision. You are capable of everything in life. Try to retain, try to have that confidence in you, and keep on going. Don't get stuck in between. Keep on going. Next question. This one, a very wonderful picture. Can anyone tell me, where do you see this snowman's heart? Snowman's heart or a snowman sign? Any random guesses? Where do you see this? Anyone? So we have Gurpreet. She's telling TAPVC. The best answer, I'll repeat again. Figure of eight appearance also I can say. If I say figure of eight appearance, figure of eight appearance. So the best answer, see, the best answer, it is not just TAPVC. The best answer is supracardiac TAPVC. Supracardiac TAPVC. Supracardiac TAPVC is the best answer. It is not just TAPVC, Saurabh. It is supracardiac TAPVC. Because I hope you know that TAPVC is of three types: supracardiac, cardiac, and infracardiac. Infracardiac TAPVC looks like a whiteout lung. Okay, that is why for this picture, figure of eight appearance or a snowman's heart, it is supracardiac TAPVC. Supracardiac details I cannot tell you right now. You have to go to through the app. We have a detailed videos, 100 hours. I have told each topic in detail. For the time being, this is a case of snowman's heart, figure of eight appearance seen in supracardiac TAPVC. That's it. What is TAPVC? Can anyone tell me what is the full form of TAPVC? Okay, what is the full form of TAPVC? Anyone? So it is total anomalous pulmonary venous connection. Gurpreet Kaur is very right. Okay, Gurpreet Kaur. Yeah, Gurpreet, you are from one of my junior is also Gurpreet. I thought you are that one. Shweta is also very right. So total anomalous pulmonary venous connection and a figure of eight appearance. It is seen in supracardiac TAPVC. Remember, not just TAPVC. Next question. So where do you see anyone? What is this sign and where do you see this condition? Any random guesses? What is this sign and where do you see this connection? Shweta is right. Kanchan is right. Okay, Diksha. Yeah. What is the shape of the heart? Where do you see? It is a box shape heart. Very good. Ria is also very right. Yes, Shweta is right. So box shape heart, it is seen in Epstein anomaly. Epstein anomaly. Epstein anomaly. Box shape heart. Can you see a big box shape heart? It is seen in Epstein anomaly. Remember that. Will you remember this? It's a simple question. Okay. Next question. Okay. So this one, this is a very wonderful sign. I will not tell who will tell me. Shivani, what do you think? This X-ray now. What is this sign and where do you see it? I'll give you 10 seconds to answer. Yeah. So Shehnaz has the best answer. This is nothing but shmoo sign. Remember shmoo, SHMOO, shmoo sign. Shmoo sign. What is this shmoo? What is this character of shmoo basically? This one. Shmoo basically it is a character in the novel comics. It is a character in the novels and the comics. Shmoo. So Shmoo sign, it is seen in LVH, left ventricle hypertrophy or left ventricular enlargement. So please remember smooth sign, it is seen in this one LVH, left ventricular hypertrophy. Okay, smooth sign, it is seen in left ventricular hypertrophy. Smooth sign, it is seen in left. Answer please. So Aman, the previous answer was the box shape heart, it is seen in Epstein anomaly. Box shape heart, it is seen in Epstein anomaly. Okay, thank you, Sudesh. Okay, so box shape heart, it is seen in Epstein anomaly. Then we have a figure of eight appearance or a snowman's heart in supracardiac TAPVC. Then we also had this sign known as signet ring sign, which is seen in bronchiectasis. Signet ring sign, which is seen in bronchiectasis. Then we had this egg on string appearance, it is seen in TGA. Then we had gooseneck sign seen in endocardial cushion defect. Okay, next. Yeah, so where do you see this? Where do you see panda sign? Anyone? Where do you see panda sign? Panda sign. Where do you see panda sign? Panda sign. Okay, Redmi. Shehnaz, yes, Shehnaz and Pratibha is right. Panda sign actually it is seen in multiple conditions, but at least remember Wilson disease. Wilson disease, you see panda sign. Wilson disease, you see panda sign. Is my voice audible to everyone? Please let me know. And I apologize for the internet connection. That is not my fault. You know, in my family, everyone has their own webinars and classes. So that's why our internet gets stuck. So panda sign, ठीक है? Panda sign, Nidhi, remember? Okay, Kanchan. So panda sign, it is seen in Wilson disease. Panda sign, it is seen in Wilson disease. So Rachna, Muskan, please remember this. Next question. Okay, what is this sign and where do you see? What is this sign and where do you see? I'll give you 10 seconds to think and write. Imagine this is an exam going on, so try your best to answer. So yes, Diksha and Shehnaz Bano, very good. So you can say it is a money bag appearance, money bag appearance, or you can also say it is a water bottle shape heart, water bottle shape heart. So where do you see this? It is seen pericardial effusion. Pericardial effusion. So pericardial effusion, you see this water bottle shape heart. Very good, Kajal. Very good, Priyanka. Rajaraj. Yes, very right. So water bottle shape heart is seen in pericardial effusion. Okay. Next question. Yeah. So where do you see champagne glass pelvis? We can appreciate this champagne glass and we can appreciate this pelvis. This pelvis is like a champagne glass. Champagne glass. So where do you see champagne glass pelvis? Any random guesses? Champagne glass pelvis, Anupriya, Sheetal. So they both are answering yes. Champagne glass pelvis, it is seen in one condition known as, only two students have won this answer. Very good. So achondroplasia. Achondroplasia. Champagne glass pelvis, it is seen in achondroplasia. Achondroplasia, we covered, it is a FGFR3 gene mutation. FGFR3 gene mutation. It is seen in achondroplasia, champagne glass pelvis. Champagne glass pelvis. Okay, please remember this. Okay, anyone have any doubt can put their answers in the comment section. And again, my mobile number is 9999897081. You can just put your name and that you were a part of the webinar. I will add you in the WhatsApp group. Okay, so champagne glass pelvis, it is seen in achondroplasia. Achondroplasia, the gene mutation is FGFR3. Next question. Who is this personality? What is your diagnosis? If anyone, what do you call, has seen, have anyone seen GOT, Game of Thrones? There's a series known as Game of Thrones. So what is this? Yes, Monica is saying dwarfism. Yes, very right. Little more touching. Yes, Shehnaz Banu is very right. So remember, it is a short limb dwarfism. Short limb dwarfism. Short limb dwarfism. This is nothing but, it's a guy, is nothing but achondroplasia. It's a case of achondroplasia. Short limb dwarfism, achondroplasia. Will you remember this? This is a if anyone has seen Game of Thrones, in the Game of Thrones, I have seen all the seasons. It is very good, you should also watch it. Little confusing the serial is, and it's very long also. It took me some 3-4 months to watch the whole series, but very nicely made. Game of Thrones, in that there is a character known as Tyrion Lannister. This was the guy, he has some 10 million followers on Instagram, and he's a case of achondroplasia, and he's having short limb dwarfism. Okay, yes, Anupriya is also right. It is one of the causes for large anterior fontanella. One of the causes for large anterior fontanelle, you can think of achondroplasia. So just remember this. Okay, you have to link and study. I always tell all my students, link and study. Don't get stuck at one question. Link and study. So you saw this picture, you know it is a case of achondroplasia. You will see champagne glass pelvis in that. There will be FGFR3 gene mutation. So 3-4 questions already covered like that. That is how you should do. Okay. Okay, next question. This was a AIMS question. This was a recent AIMS question. Where do you see claw sign or coiled spring sign? Claw sign or coiled, this one. Can you see that? This like that. So coiled spring sign or claw sign. Anyone? Where do you see? Diksha? No. Ria? Okay, so Sheetal has the best answer. Sheetal and Kanchan. So coiled spring sign, it is seen in intersusception. Intersusception. Coiled spring sign, it is seen in intersusception. Please remember this. Again, exam question. Coiled spring sign or claw sign. Shweta is right. Sangeeta is also right. Rekha also right. And Sapna also. So coiled spring sign, it is seen in intersusception. So what is a triad? Can anyone tell me what is, right, intersusception? This one part of the bowel goes into the another part of the bowel, invagination of one part of segment of bowel into another segment of bowel. So what is a triad? Can anyone tell me what is the triad of intersusception? What is the tri See, you have to know the triads. You have to know the triads. Okay, so remember, PPR. Okay, pain, abdomen, palpable mass, and red currant jelly stool. Okay, so pain, abdomen, palpable mass, and red currant jelly stool. That is the triad for the intersusception. Remember that. It was a recent AIMS question. You must know pain, abdomen, palpable mass, and red currant jelly stool. Pain, abdomen, palpable mass, and red currant jelly stool. Please remember that. Okay, you should know. Next slide. Again, a small motivation before you fall into sleep. There is nothing known as right time. There is nothing known as right time. A lot of juniors of mine, they come to me and say, Kaka, I am starting studying, sir. So this week I'm just going somewhere out, and next month me and my friend together we will study. So my dear, to all those people who are thinking that way, there is nothing known as right time. This is the time which is right. Like today, right now, this is the time. How much ever you can retain, remember in this class will come in exams. It will come in exams. So this is the right time. Use this time wisely, and this time becomes your right time. So don't wait for the right time to come. Just create it right now, and try to remember how much ever points I am telling you. Okay. Next, what is this X-ray? Not X-ray. What is this picture? Anyone? What is this picture showing? Is this a normal baby? What is it showing to you? Any random guesses? Monica, what do you think? I'll give you 10 seconds. So is this normal? Baby's hand is normal? Can you appreciate anything, or is this perfectly fine? Anju? Very good. So Muskan has saying me 1 point, widening of wrist. Yes, widening of wrist is there. I agree with you, Muskan. Swelling, you can say, or a widening of wrist sounds better. Tanuja is also very right. Okay, I got this X-ray of this child. I got the X-ray of this child. This is the X-ray. So can anyone tell me now what is this? So once I got the X-ray, I found this. So I found cupping. This is cupping. This like this. This is fraying. Okay, yeah. So this is fraying. This cup shape is cupping and splaying. What is splaying? Widening of wrist. So in children, I see it's a pediatrics topic. So in children, usually rickets should be ruled out. Instead of fracture or this and that, you rule out rickets first. They usually come with widening of wrist and bowing of leg, like I told you. So cupping, fraying, and splaying is the rickets. Okay, it's a rickets. Okay. Last 10 minutes left, then the class will be over. Try to retain and remember how much ever you can. This one. It's a very wonderful X-ray. It's a very common X-ray asked in exams. What do you think? Okay, so Pooja is answering. Kirti also answered. What is this sign? Okay, what is this sign? Okay, so can you see this one? What is this sign? This, what are these signs? What is this? So this is nothing but, please remember, hair on end appearance, hair on end appearance, or you can also say crew cut appearance, crew cut. अलका इज सेइंग टच मी नॉट प्लांट जैसा लग रहा है. नहीं अलका, वो नहीं लग रहा है, ये वाला है हेयर ऑन एंड अपीयरेंस और अ क्रू कट appearance. It is seen in thalassemia. It can be seen in thalassemia, or also it can be seen in sickle cell anemia. Thalassemia or sickle cell anemia. Okay, thalassemia or sickle cell anemia. It is nothing but a what you called hair on end appearance or a crew cut appearance. Hair on end appearance or a cut appearance. Okay, remember this. Okay, hair on end appearance or a crew cut appearance seen in thalassemias or sickle cell anemia. Okay, I'll give you a toffee if you can answer me this one. This is a tough one. Rare questions for rare students. What is this picture? The highlighter is, it is a puff of smoke appearance. This is a cerebrum, like a cerebral hemisphere, brain it is, okay? And it is like a puff of smoke. So we have one plus. I don't know your name. Your name is written one plus. So one plus is answering again and again. So it's a case of anyone. She has answered right. So it's a case of moya moya. Moya 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 moya. So moya moya disease. I'll just show you the spelling. So puff of smoke appearance, it is seen in moya moya disease. Remember that. It's just a one-liner question. Always come in exams. So puff of smoke, but it's a rare question. Okay. So puff of smoke appearance on the cerebral hemisphere. It is like a puff of smoke, and it is nothing but seen in moya moya disease. Seen in moya moya disease. Please remember this important question. Please remember. Okay, moya moya disease. Yeah. Next, this one. So what do you think? This is a very common X-ray. This is not the X-ray picture. This is a very common picture for MBBS students also, for nursing also, for final year students also. Very common picture. Very common. Okay, Usha Rani wants to see that. Okay, Usha, for this for student name Usha, I'm putting this slide. So Usha, do you want to see this picture or the previous picture? So Usha, this is a case of rickets. You saw the cupping, fraying, and splaying appearance. One of our students, she wants to see the previous picture. So this is nothing but what you called cupping, fraying, and splaying appearance. It is seen in this only. Okay, perfect. Okay, this is seen in rickets. Coming back to the continuation, this one. Yeah, this is nothing but Bitot spots. Bitot spots. Very good. Very nice. Because of vitamin A deficiency. This is a very common finding, very common question that it has asked for MBBS, for PG, for nursing, for everyone. So vitamin A deficiency, nothing but Bitot spots that you should know. Okay, Bitot spots, vitamin A deficiency. Please remember this. Okay, please remember this one. Okay, I'll show you a video now. So can anyone tell me this? I'll show you one video. 1 second. Mm. Yeah, now watch this video. Watch this video and give your best answer. What do you think this boy is having? This patient had come to my OPD. Okay, Kanchan, what do you think? What is this? What is this? The baby is not able to get up. The baby is not able to get up from the sitting position. What are we dealing here? What do you think? What is this? He's not able to get up. He's not able to get up. Okay. So yes. So very right. So this which just now we saw, like not able to, this baby was not able to get up from the sitting position. Is nothing but Gover sign. Gover sign. Gover sign. Okay, the baby was not able to get up from the sitting position. I'll show you one picture. This one. This is a very important. Same. There's nothing but Gover sign. The baby was not able to get up from the sitting position. Seen in DMDs. What is DMDs? Duchenne muscular dystrophy. Very important Gover sign. Like, can you see the child, like he is not able to get up? He's to to get up like this, and then now he's getting up. So nothing but known as Gover sign. It is a case of muscular dystrophy. It's a case of muscular dystrophy. Nothing but seen in conditions like DMDs. DMDs is nothing but Duchenne muscular dystrophy. Duchenne muscular dystrophy. Remember that, okay? Simple question. Okay, last 5 minutes left. Then the class is finished. Then what is this picture showing now? Anyone? It's a very important picture. What do you think? What is this picture showing to you? Is this normal? Is this okay? I'll give you a hint. What is this one? Can you see this extra? Some things are there. Anyone? So yes, so we have, yeah, very good. So it's a case of rachitic rosary. You can see a beaded appearance at the costochondral junction. Beaded appearance at the costochondral junction. This is the costochondral junction. Costochondral junction. This one. This. I'll show you one more picture also. Can you see that? This one. Can you see this? Yes or no? This one. It's a beautiful picture of rachitic rosary. So very good, Neetu. Costochondral junction. You saw the beaded appearance, like small beads, round beads. It's a case of rachitic rosary. Nothing but is seen in vitamin D deficiency. Okay, vitamin D deficiency. Okay, I hope the screen is moving. This one. Okay, so yes, it's nothing but rachitic rosary. It is seen in rickets. Okay, next one. So written portion. Okay, one second. So this is the written portion, Monica. This is nothing but rachitic rosary. It is because of vitamin D deficiency. It is the beaded appearance at the costochondral junction. Okay, Monica, I hope you got it. Okay, I'm coming back to the continuation, last 3 slides. This one. Yeah, so now again coming to this picture, people have already started answering. Vikram, Swati, Rahul. Yes. So it's nothing but anyone. Do you like her necklace? Like, what is the connection? Shivani. Yes, it is a case of pellagra. It's a case of pellagra. Pellagra is because of which vitamin deficiency? Anyone? Vitamin B, which one? B1, B2, B3, B6. Anyone? B3. Very good. Which is Kanchan? Which is vitamin B3? Which is vitamin B3? What is the name of the vitamin B3? Very good. It is niacin. Very good. Vitamin B1 is, which is vitamin B1? Anyone? Vitamin B1 का नाम क्या होता है? दीक्षा. Yes, vitamin B1 is thiamine. Vitamin B2 is anyone? Which is B2? Tanuja. B2 is, yes, Pooja is right, riboflavin. Okay, so B1 is thiamine, B2 is riboflavin, B3 is niacin. Anyone? B5? Vitamin B5 is anyone? Pantothenic acid. Yes or no? Pantothenic acid. Very good. B6. Pooja, B6. Priyanka is right. B6 is pyridoxine. Very good. Very good. B7. B7 is also there. Anyone? B7. Yeah, biotin you can say, or vitamin H also. Biotin. And last B12. B12. Anyone? Which is B12? Yeah, so cyanocobalamin. So very good, very good. So means no one is sleeping in the class. 308 students are awake themselves. Very good. That's nice to hear. So B1 is thiamine, B2 is riboflavin, B3 is niacin, B5 is pantothenic acid, B6 is pyridoxine, B7 is biotin, and B12 is cyanocobalamin. Okay, so do you, this picture basically is showing the problems, the dermatological manifestations because of the vitamin B3 deficiencies. It's a condition known as pellagra. It is a condition known as pellagra. This much you should know. That's it. Next. Last 3 to 4 slides, then the class is over. Again, for the students who have not joined the group, 9999897081. This is the mobile number. You can put your, what you called, your name there, and I will add you in the WhatsApp group. Okay. Yeah. So Pooja is right. Kirti is also right. Good. I know you all are toppers. I'm very happy you know that. Now, next question is, name the drugs which can be given intratracheal. So let's see if how many of you can answer this question. Okay, Reshma and Ashutosh. Okay, so what are the drugs? Can anyone tell me what are the drugs given intratracheal? Anyone other than adrenaline? So remember, the mnemonic is nasal, NASAL, N for naloxone, A for adrenaline. Very good, Anil. S for surfactant. Another A is atropine. L for lignocaine. These are the drugs given, what you called, intratracheal. The mnemonic is nasal, naloxone, adrenaline, surfactant, atropine, and lignocaine. These are the drugs given intratracheal. Okay, Shivani is saying epinephrine also na sir. So Shivani, adrenaline को ही epinephrine बोलते हैं. Adrenaline is also known as epinephrine. Okay, remember that. Okay, so same thing only. Okay, so naloxone, adrenaline, surfactant, atropine, and lignocaine. Okay, remember that. Okay, लिख लिया इतना. Last 2 slides. This one. So what is the milestone baby is showing to you? What is the milestone the baby is showing to you? Any random guesses? What do you think? What is the milestone showing? What do you think? Anyone? So yeah, so you can say the baby is sitting in a tripod position, right? Tripod. Or you can say sitting with support. Sitting with support, number one, or also known as tripod position. Tripod position. So anyone, sitting with support comes by. So sitting with support comes by 6 months. Sitting with support comes by 6 months. And sitting without support, 8 months. Sitting without support, 8 months. Very good, Pooja. Very good, Deepika. So yes, sitting with support 6 months, sitting without support 8 months. Okay, next. A very rare question. If this you can answer, I mean, I will give you like whatever you want. So what do you think? This is a very rare question again. I love asking difficult questions. So what do you think? The hint for this, Rahul, the hint is telephone receiver femur. Where do you see telephone? Can you see that? Can we appreciate a telephone receiver? ऐसा लग रहा है जैसे टेलीफोन का रिसीवर हो. Can you see that? Yes or no? So telephone receiver femur. So telephone receiver femur. Where do you see this condition? So anyone? Telephone receiver femur. It is seen in any random guesses? Wild guesses? Meghna. Yeah. So the best answer, Rachna. Rachna Sonekar. Sonkar. So Rachna has given the best answer, and the best answer for this question is telephone receiver femur. It is seen in, yeah, Astha also came now. So Astha and Rachna, very good. Thanatophoric dysplasia type 1. This is where you see the telephone receiver femur. Telephone receiver femur, it is seen in thanatophoric dysplasia type 1. Okay, telephone receiver. Oh, now Shipra also. Are you guys going Google? I think you are doing Google. I can see that. Okay, so very good. Thanatophoric dysplasia type 1, that is nothing but you see telephone receiver femur. Telephone receiver femur. Okay. One more beautiful rare question. If anyone have the willingness to answer, I'll just wait, I'll show you. Yeah. Now see this video very carefully. See this very carefully. Now look at this. So what is this picture? What is this picture? What is this picture? Anyone? Vivo? Ria? Ria says anencephaly. Okay. Anyone? The highlighters. There are multiple highlighters in this picture. We can see only one single eye. We can see no nose. We can see microcephaly. Like if you collaborate all this in one, what is the answer? So Sheetal is right. Swapnil is almost right. Okay. Anyone? Pratima. So what do you think? It's a case of, it's a case of anyone? So it's a case of holoprosencephaly. Holoprosencephaly. I'll not go into detail. It is there in the mobile app. Just you should know it's a case of holoprosencephaly. Remember, Priyanka, Priyanka, remember holoprosencephaly is not a neural tube defect. Remember, holoprosencephaly, it is not a neural tube defect. It is a forebrain anomaly. Okay, it looks like a neural tube defect, but it is not. It is a forebrain anomaly. This specifically has been a recent question 2 years back actually, that is it a neural tube defect? No sir, it is not a neural tube defect. It is a forebrain anomaly. That much you should remember. It was a specific question, that is why I thought of telling you now only. So it's a case of holoprosencephaly. Okay, holoprosencephaly. Okay. Okay, wait, let me ask you more questions now. Okay, this one. Okay, so Pavani, tell me the answer for this. What is, if I, eye of tiger sign? Like where do you see eye of tiger sign? Tiger Rahul, I also can see the tiger. Okay. So tell me, eye of tiger sign is seen in Sunil. I will try to put some part of it on YouTube, my dear. Ria, no, it is not Wilson. I'll show you a MR picture of this. Now tell me, eye of tiger sign. This is the, see, this is the eye. Okay, eye. ये उसकी मूछें हैं टाइगर की. So eye of tiger sign. Anyone? Tell me fast. Eye of tiger sign. It is seen in. It is seen in Anita. What do you think? Last guesses. What do you think? One of the toughest question if by mistake come in exams. Eye of tiger sign. Eye of tiger sign. It is seen in pallidus. Pallidus. No. Anyone? Anyone? Last chance. 5 seconds. Eye of tiger sign. Remember this. Remember this is the first and the last class. Like imagine this is the first and last MRI picture you're seeing this. So yes, Ria has come with the best answer. Yes, Pratibha and Ria, after watching Google, they are answering. It is seen in PKAN. Eye of tiger sign. It is seen PKAN. What is PKAN? Pantothenate. Pantothenate kinase associated neurodegeneration. Sunil, I told you they are watching Google. So pantothenate kinase associated neurodegeneration. Eye of tiger sign, it is seen in PKAN. PKAN is a condition, nothing but pantothenate kinase associated neurodegeneration. And that is also known as a syndrome known as Heller-Warden. Heller-Warden-Spatz syndrome. Heller-Warden-Spatz syndrome. कंफ्यूजन नहीं है डियर उसमें, द प्रॉपर इमेज एमआरआई इट इज शोइंग लाइक दिस कंफ्यूजन तो आगे है, बट जो मेन फाइंडिंग है, वो ये वाला है जो अप्रिशिएट करना है इसके अंदर, ठीक है। सो आई ऑफ टाइगर साइन, इट इज सीन इन PKAN, that is pantothenate kinase associated neurodegeneration, and it is also known as Haller-Warden-Spatz syndrome. Haller-Warden-Spatz syndrome. Haller-Warden-Spatz syndrome. Last two image, this one, what do you think? Any random guesses? Any random guesses? What do you think? What do you think? Who will tell me fast fast? शिप्रा, बहुत सारी स्लाइड्स हैं, कैसे दिखाऊं सब पुरानी स्लाइड्स? This one is eye of tiger sign, Shipra. This is nothing but eye of tiger sign. It is seen in PKAN, pantothenate kinase associated neurodegeneration, and this one, eye of tiger sign, eye of tiger sign. ठीक है? Now coming to this one again. Yeah, what is this? Tell me fast. थोड़ा बड़ा कर देता हूँ इसको आपके लिए. So no, this is not overlapping skull bone, Pallavi, but good, you tried. Anyone? Shipra, what is this? A very beautiful picture. Tell me fast. What is this? Who will tell me? Shipra? Pooja? No. This is not a rare picture. It is a very common picture. Last 2-3 minutes left. We are already crossing 1 hour. I had planned to keep it for 1 hour. Otherwise, we can never stop studying and teaching. So, what do you think? Hemorrhage? No. Okay, now right. Tram track sign. Tram track sign. Tram track sign. ये दिख रहा है? Can you see that? Like, can you see this like this, like this, like this, like this, like this, like this? So can you see all that goes like this? What is this? It is this one. See this. Can you see trains going tram track, Calcutta trains? Yes or no? Can you see they are overlapping this and that, the whole lines? So tram track sign, tram track sign, tram track sign. Remember that, okay? Tram track sign. Suraj, Sujan. What's your name? Srijan, right? In Hindi you have written. I can't appreciate. Well, I will remember it properly. So tram track sign, it is seen in which condition? Who will tell me? So please remember, tram track sign, it is seen in one of the important scene in Sturge-Weber syndrome. Sturge-Weber syndrome. Sturge-Weber. Very good, Ria. Tram track sign, it is seen in actually 7 different conditions, but right now in the webinar I'm telling only one. Sturge-Weber syndrome. It is one of the neurocutaneous syndromes. Okay, Sturge-Weber syndrome. Tram track sign. Okay, Sturge-Weber syndrome. That's it. Okay, next. What is this? Tell me fast. Surgery question. I should not be teaching you this. What is this? Anyone can answer this question? What is this intestine coming out? What is this? The whole intestine have come out. Priyanka, these images are important. They have come in exams. All are linking here and there. You should, whatever comes, you finish it off. That's all I can say to you. So many of us are answering wrong. Vikram, is it a omphalocele or something else? Is it a omphalocele? Are you sure? Sub Krishna, what do you think? Is it a omphalocele? My voice is coming only, I guess. If now, what is this? Okay, what is this now? Anjali, what is this? Survival is there of this baby. Don't worry, we'll operate and we can nicely clear it off. Put the contents back. So can we appreciate these two picture? Yes or no? One is this picture where the whole contents are out, but there is no covering. There is no covering. Can you appreciate? But can you appreciate this picture that the contents are out, but there is a covering? Yes or no? Can we appreciate this? There's a covering, right? Cover है ना ये कुछ है sac सा covered नहीं है ये. Yes or no? Yes. So Ria is now answering right. This is a case of omphalocele. Point number 1. In omphalocele, the contents of the intestine will be out of the baby's body, but they will be covered in a sac. They will be covered in a sac. Remember, okay? And if the contents are out without the covering, that is known as gastrochisis. Are you understanding? Yes or no? One is known as gastrochisis. Rachna is also very right. So gastrochisis, the contents of the intestine are out without a covering, without a sac. Okay, Anjali. Okay, Anju. And in omphalocele, there the contents are out, but there is a covering there known as omphalocele. Even this case also, what is this? Now, what do you call this? Is this a gastrochisis or omphalocele? So it's a omphalocele. Yes or no? Kyuki, of course, because of the whole, it's covered, right? Omphalocele. Okay, that you should know. Okay, last question. Last, should I ask a tough question or easy question? I'm thinking about that. What do you want? Easy or tough? Okay, let me ask you a very easy question. Okay, this one. Let's, because otherwise the webinar will not get over. Okay, who will tell me the blue color candela is which number? Every day we are posted in NICU, PICU, we put canelas, right? Pallavi is answering very good. So blue is 22 number. Yellow, anyone? Yellow? Yellow is 24. Very good. 26 is which color? 26 number IV candela is which color? Which color? Yeah, so violet. You can say violet. Okay. Okay, gray and green. Gray is which color? Green is which color? Any idea? Gray is 16. Gray, green. Yeah, 16, 18. Very, very, very important question. Very good, Aman, Lakshmi, Monica, Pooja. I'll just show you one picture now, okay, and that can finish the whole slide. This is the picture. Very, very important picture is there on my Instagram also. Remember now, इसमें से याद क्या करना है? What do you have to remember? The blue color one. The blue color one is 22. Okay. The yellow color one is 24. Violet is 26. Okay, these are important. Okay, these are very, very important. And I told you gray, this 16 and 18. Okay, this one, gray green 16